Friends, in this video we are going to see management of a white cataract with hard nucleus. Capsulorhexis is done in such cases in two stages. This is the first stage after staining the anterior capsule with trypan blue dye. A small rhexis is done and then some cortex is aspirated with a Simcoe cannula. One can use bimanual irrigation aspiration also in such cases, but Simcoe cannula is a very simple instrument for this purpose. Now, after injecting visco and making a nick at the margin of the mini rhexis, the rhexis is enlarged to an optimum size of about 5.25 millimeter. The nucleus is quite hard and I am going to use my technique submarine chop for this nucleus to divide the nucleus into pieces and then emulsify the pieces. Ultrasonic energy is about 80%, flow rate is 45 and vacuum is 450, and here goes the tip of the phaco needle into the substance of the nucleus. And the tip travels through the substance of the nucleus towards the opposite equator. And a nice crack is obtained. Rotate the nucleus on 180 degree. In this case, I made few scalds at the central part and then divided the nucleus into two heminuclei. Each heminucleus is then subdivided into smaller pieces. With this technique, with this submarine chop technique, management of such hard nuclei are really very simple. Emulsification of the pieces are carried out. Ultrasonic energy is 80%, flow rate is 45, vacuum is 450 millimeter of mercury, and this setting is from the beginning of the surgery, from beginning of nucleus management. And during management of this last piece of the nucleus, the vacuum is reduced to 250, flow rate is 25 and ultrasonic energy used is 65%. The nucleus is managed and this is real-time management of the nucleus. And the cortex is then removed with the help of this Simcoe cannula. After removal of cortex, a monofocal intraocular lens is implanted in the capsular bag and it is done under irrigation. The main wound is enlarged little bit and then the lens is implanted in the capsular bag. Size of the main wound at this time is about 3 millimeter and astigmatism induced is less than 0.5 diopter. The side port is closed by hydrating corneal stroma and then a final lavage of the anterior chamber is carried out. The antechamber is nicely formed and then the case is concluded. Thank you very much for your attention. Hope this video will help you in developing your surgical skills.